in treatment option for at least psychogenic PME, the most important thing is sex education, and proper and scientific sex education, and handling the myths. 50% of the PME, psychogenic PME, in my practice, can be taken care with this approach, a proper scientific sex education and handling the myths. Good afternoon, everyone. First of all, thank you very much, respected chair, for introducing me. Thank you, Dr. Ajay and family, as well as ISMP family, for giving me this opportunity to connect with all of you. The topic allotted me for talk is Psych and Ejaculatory Disorder and how to address it. And in tea break, Dr. Ajay asked me to prematurely ejaculate my presentation. I have only 15 minutes. So ejaculation disorder, premature ejaculation, retarded ejaculation, and ejaculation. So primarily I'm going to talk about premature ejaculation only. The topic is going to cover under this part: introduction, definition, etiology, and risk factors, symptoms and diagnosis, impact on individual and relationship, and treatment options. So why this topic is important? So we all know that 20 to 30% of the men experiences premature ejaculation in some point in their life, and American Urological Association says that it is the most common type of any male sexual dysfunction. So the magnitude of the problem is quite high. Definition, premature ejaculation, I just highlight. Usually there are multiple diagnostic definition, you can say. Like American Urological Association is having different, then International Society for Sexual Medicine, DSM-5, ICD-11, they are having a different definitions, but crux is almost little bit same. I usually follow the premature ejaculation DSM-5 definitions. The important thing, 2 words: persistent and recurrent pattern of ejaculation. If it is with partnered sex, less than 1 minute. If it is non-partnered sex, the duration has not mentioned. And if the symptoms last for 6 months, then only we can say that that is a premature ejaculation. Then specifiers are there, which Dr. Akhil has already talked about it, so I'm not going in detail. So etiology. So for premature ejaculation, organic, psychological, and psychosocial. Organic, it's already discussed. So I'm skipping these slides and I directly jump onto the psychological factors. So psychological factors associated PE, historical perspectives are there. The psychoanalytical theories, which we learn when we were in post-graduation, psychoanalysis, Sigmund Freud, everybody knows about that. The psychoanalytical theories says that it is a neurosis linked to unconscious conflict. And Master and Johnson suggested that the etiology of the PE is a learned behavior. Kaplan, he suggested that this is a lack of sensory awareness. So this is a historical, psychological aspects of a PE, how they have explained and defined PE. So psychological and psychosocial factor, performance anxiety. We know that PE, the most common cause is a performance anxiety. Performance anxiety, why? 2 things, fear and concern. Fear that the partner will not get satisfied, and concern, excessive concern about own performance. These two things can lead to a lot of anxiety. And anxiety itself increases the sympathetic tone. At the same time, anxiety distracts that individual from the level of arousal. And once that person gets distracted from the level of arousal, it is very difficult to control arousal as well as ejaculation. This is how the performance anxiety, why performance anxiety occur, and it leads to the PMA. Second, cognitive factors, belief, sexual knowledge. So, cognitive factors, the person is having some very psychological disorders, or if you find the person is having some cognitive distortions, as in the morning, one of the urologist friend has asked, Dhat syndrome, a patient with a Dhat syndrome, it's very difficult to treat, right, sir? So sometimes it's not only about handling the myths, but understanding whether that thought is getting deluded, obsessed, that differentiation has to be there. Once you properly assess the mental health or mental status of that person, and if you differentiate that it is not just a misconception, but now it's totally deluded or totally obsessed, then we can have an intense CBT for that patient. So intense CBT can work for that patient. So psychotherapy is advised whenever there is a cognitive distortions or any psychological health related issue. Then behavioral therapy. Behavioral therapy, the goal is to achieve better ejaculation control. So for behavioral therapy, there are few exercises or behavioral techniques is advised. The sensate focus exercise or foreplay, about which Brahma Bhatt sir is going to talk tomorrow, so I'm not going to in detail, but this is something where, as we know that the sex organ doesn't lie, sir, Murugan sir said, sex organ doesn't lie between two thighs, it lies between two ears, that is brain. And the largest sex organ is the skin. So skin and brain, when comes together, without any fear of performance, without any fear of intercourse and orgasm, that is a sensate focus exercise, roughly. Then communication skills. Communication skills are very important between two partners. The communication skill should be, means the partner should be open, empathetic towards each other, non-judgmental. Then they should able to share without any fear. Means sharing has to be there. The acknowledgement of the symptoms and distress has to be there between two partners. The communication skill is very important because sex is an act between two people. If one person is not able to help out another person who is going through that some sexual issues, then it will not work. So communication skill is very important. Sex position, various sex position is advised, but usually female on top position is advised for some PME patients and seems to be helpful. Then squeeze technique, stop-start technique, these are few techniques. Squeeze techniques usually interferes with the path of ejaculatory reflux. We know that squeeze technique, everybody knows about that squeeze technique, that it is giving a firm, applying a pressure at the base of the penis. When a person feels that he is going to ejaculate. So this is squeeze technique. And stop and start technique is that these two techniques are mainly based that the person should get aware about his level of arousal, and he should get control on his level of arousal and excitement. So squeeze and stop start technique is for there. Relaxation techniques are mainly to relieve the anxiety related with the performance. Pelvic floor exercises like Kegels exercises, I think andrologist can better talk about that. Distraction techniques and masturbation practice. Masturbation practice mainly involving stop and start principle, can be helpful to improve his time. So that can be helpful. So these are three things: sex education, CBT, and behavioral therapy. Pharmacotherapy, definitely initially sometimes pharmacotherapy can be helpful for individual to get a confidence that the things can be curable. So pharmacotherapy, sildenafil can be used, tadalafil can be used. Even shortest acting SSRI is depoxetin, 30 to 60 milligram depoxetin can be used. Long acting SSRI like fluoxetine, paroxetine, and TCS like clomipramine, 10 milligram, clonil 10 milligram, this can be helpful to have delayed ejaculation as a side effect of the medicine, which we can use as an effect of the medicine. Anxiolytic can be prescribed initial days to just relieve his anxiety and get into some therapy sessions or counseling sessions. So this is all about the premature ejaculation. Delayed ejaculation, I think Dr. Akhil has already talked, so I'm just skipping this part. But delayed ejaculation also, the treatment is almost like CBT, or it's about understanding the cognitive distortions and addressing and helping the patient to get better cognitions or better adjusted cognitions. So takeaway points: sexual relationship is just like other relationship. Sometimes it is good, sometimes it is not good. The key to success is good communication and desire to solve the problem. Sex is most rewarding when it is a part of a caring, enduring relationship. Affection, respect, and trust are the most important part of good sexual relationship. Thank you. Thank you very much for patience listening.
Thank you, Dr. Sunil. Well, it is open now for the questions, if there are.
Treatment for delayed ejaculation, pharmacotherapy, I am asking.
Pharmacotherapy. Sir, for pharmacotherapy, as I already talked, SSRIs can be used. If it
Ejaculation, sir.
delayed ejaculation, you are asking. Delayed ejaculation. Cyprohepatidine, which is usually used as an appetizer.
Appetizer, but it is very good in delayed ejaculation.
Any other insights?
But the results are not that much promising. I think the counseling is much better option.
Thank you, sir.
Is there any effect of increasing frequency in premature ejaculation? Because I usually tell patients that like lifestyle modification, I tell them sexual life modification. FFP formula. F is increasing foreplay for 15 to 20 minutes, increasing frequency daily or at least alternate day, and position, as you said, female on top position. So I just want to know whether there is any studies or any data that says that increasing frequency will cure the PME or will help in this.
Dr. Atul, I don't know about the data available, whether it states that increased frequency can increase the premature ejaculation, but I feel the frequency of sexual relationship is a very individual thing for that partner. So we can advise them to get intimate more. And as there are many behavioral therapy techniques like sensate focus exercise definitely can be helpful for such patients. But I'm not aware about the data.
Sir, I'm Dr. Dipayan Sarkar from Agartala, sir. Sir, in some cases we have seen that there is some hypersensitivity in the part of the glans penis, So if there is more touch and something, patients used to complain that it also may lend up to this premature ejaculation. So any comment on that?
It can be organic PMA. And yes, some patients are having a hypersensitive glands,
Yes.
which can be taken care by initially with some local anesthetic gels also.
Like what, sir?
It's a lignocaine gel. Usually we commonly use that.
Yes. Circumcision. Okay.
But being a psychiatrist, I will advise one thing, sir.
Yes.
That we should make that person literate, aware about his level of arousal and understand about the sensation on glance and try to do few changes so that he can have a better control on ejaculation.
How to do that?
It
changes, sir?
can be
Because this
it can be
sensitivity
done with
comes-
CBT as well as it can be done with the proper counseling sessions.
So actually, can you few lights on that? How to do that CBT? Just few lines, guidelines for that one.
So that is what I said. CBT is a cognitive behavioral therapy. The basic principle of CBT, cognitions means thoughts gives rise to behavior, thoughts gives rise to emotions, and emotions gives rise to behavior. We understand the behavior, we understand the emotions. We just need to focus and find out the malcognition which is giving rise to a wrong behavior. So this is like CBT sessions. It is a specialized counseling type.
Okay. Thank you, sir.
I'm Dr. Regine from Calicut. One of my comment is about this treating with SSRI. SSRI decreases the libido, so treating with SSRI is not possible with this patient with a premature ejaculation. Usually it is not possible because it decreases libido, but it increases the time of ejaculation. Usually we give this local anesthetic, lidocaine or lignocaine, gel, not spray. Spray causes dampness all over the penis and that causes loss of erection. Usually we apply the cream over the hypersensitive areas, that is frenulum and corona of the penis, and wash it off after 15 to 30 minutes. They can perform the act up to 30 minutes. Most of the patients are improving this type of management. Mainly, this main problem is lignocaine can cause hypersensitivity, burning sensation, and some patient giddiness and tachycardia. So be careful about anaphylaxis and this type of problem, side effects. So, but most effective treatment is the application of this lignocaine gel, not spray.
As you said, sir, it has to be very rational use. Otherwise, people usually start with the lignocaine gel only and they lose this, the sensation. And we all know that sex is all about pleasure, not performance. So many times, many people irrationally use it. Not about a doctor.
Loss is only that area,
that
hypersensitive area only. You can get sensation other areas.
May I answer?
Yes, sir, yes.
So the thing is, are having premature ejaculation, having anxiety disorder, more than 90 to 95%. So low dose of paroxetine or fluoxetine, basically that decrease anxiety and that not decrease libido even if they use lifetime.
What about TCA then?
TCA is more complicatory. They decrease libido, they decrease other side effects like the typical side effects of TCA. Paroxetine, I prefer first paroxetine, second is fluoxetine, and I'm using in the patient like if the primary premature ejaculation, especially the cases when there is primary premature ejaculation, there is no treatment helps except SSRI. And the people are using for years and there is no single case of decreased libido.
Hello?
Because in PME, the decreased libido cases come when they are treating for depression.
this main problem with SSRI is you have to continue the drug.
Very rare.
You have to continue the drug. Then only the effect will come. Usually it will start about 6 week to 6 week duration to start to initiate the effect.
That actually you have to make it clear to the patient that it will not going to help you since you start. It will take help.
It will
at
take
least
some
after
time.
4 weeks.
Then other problem is other side effects of SSRI, headache and GI problem, nausea,
Sir,
and
they are getting stable within 1 week.
Okay.
Within 1 week.
SOS use is not useful.
Sir, SOS not.
Sir, depoxetine can be used on SOS basis.
Depoxetine, I
1
don't
minute
feel that
regarding-
it helps.
Now,
Sir,
My
1 minute regarding the spray and the gel. Absolutely, there is no difference because the spray and gel has to be applied on the frenular area. If you apply even the ointment on the other areas, it will be numb. So both are equally useful. Now the Cipla has launched a spray with prilocaine. And coming to the lignocaine gel, that will act only for 30 minutes. So after 10 minutes, that too it is 10%. So we have to ask them to have sex after 10 minutes of the spray or the spray. So plain lignocaine will act only for 30 minutes. With prilocaine, it will act for a long time. Now there are Lidonir, that is the product name, Cipla, that is with the lignocaine and prilocaine.
Gel, one of the problem with the spray is that is dose you can't control. Other gel you can take small quantity and that will give maximum effect.
No, in fact, as far as the penis is concerned, even if you apply 2 or 3 more spray, nothing will happen because it is not intravenous. The sprays are like that. Prilocaine combination will not, 2-3 sprays extra will not exceed the dose because the dose of lignocaine is, I think it is 2 milligram per kg body weight.
so I'm having one thing regarding the delayed ejaculation. Recently I had a case, came with a complaint of anejaculation. Usually the people are having a thought that delayed ejaculation will satisfy the partner. So he developed himself delaying the ejaculation by diverting his attention during the act. So he is used to do 10 minutes, 15 minutes every time. So it ends in, it is a totally anejaculation. So this is, he is not able to complete the sexual response cycle properly. So the diversion attention is not good, and anything more than 5 minutes, it is not good. So that's what I want to tell about the delayed ejaculation.
Sir,
Yes, sir?
That patient developed orgasmic ejaculation or
Orgasmic ejaculation.
all said and done with these local anesthetics, I have one observation which I would like to share with you all. Is these local anesthetics, the problem with them is that they interfere with the pleasure. And the purpose of having sex is to have pleasure. So I don't find any rational in using local anesthetics, and the women is not able to experience the sensations because the local anesthetics will be numbing the sensations.
hello.
Hypersensitive to glands. The only indication for lignocaine application.
We will stop now.
And
Amit.
and they are advising right, left, and center these jellies. That is, I really don't understand and approve of it. Second part, somebody said that circumcision is one of the ways to desensitize. It is not foolproof. It is not proven. In fact, circumcision is one of the reason for particularly, some later stages somebody undergoes circumcision, say diabetic-induced phimosis and all. They might develop oversensitivity, or they might end up having a premature ejaculation.
Thank you.
Sir.
Thank you, Dr. Mutal.
Excuse me, sir.
Thank you,
as a
sir.
surgeon, I do a lot of circumcision. Circumcision doesn't cause any problem, and moreover, desensitization of the glands, because it is exposed to the exterior, and in the undergarment it is constantly rubbed. So the sensations are numbed down, and it doesn't cause any problem. The problem which he told, in diabetics and other, that is another issue. That is vascular and neurogenic. But as far as in our city and otherwise, in medical profession, many doctors, they go for circumcision for the sexual pleasure on demand.
Yes,
and I
sir,
have done many circumcisions.
Yeah, we are running out
Sir,
of time. Sir,
last
kindly
7 days.
cooperate. Kindly cooperate. Time
Hello,
is
sir.
gone.
Sir, one question, sir. Last 7 days before, I sent a pic, penile sapt. Excuse me, sir. History of patient, Viagra taken and lignocaine gel used. I sent the pic last 7 days. So possible.
We will be discussing it later.
Yes.
I now invite Dr. Sontake sir to felicitate Dr. Gowda sir. Register